Here's Everyway Woman.
We're back with Dr. Chen of Breastlink. She's the director of breast radiation. Thank you for being here, Dr. Chen. Well, we have so many more questions. With your mammography, if you get a report that's negative, can you just be like, okay, I'm clear. I don't need to worry about it anymore?
Well, mammography is the best tool that we have for the early detection of breast cancer. So if you receive a report that says your mammogram is negative and it's normal, that's wonderful news. But nothing in life is perfect, and mammogram is included in that. It's not 100% perfect. And certainly if one has dense breasts, there are limitations to the mammogram. A cancer can be hidden in the tissue and not seen on the mammogram in a woman with dense breasts.
And what's the difference between screening mammogram and diagnostic mammogram?
That's a very commonly asked question. So a screening mammogram is a mammogram that's taken in a woman who has no breast problems that she's aware of or that her doctor feels any abnormality. So everything is in an asymptomatic woman. On the other hand, a diagnostic mammogram is for a woman who has a complaint or feels a lump or notices her nipple is retracted or sees a little leakage from her nipple, or is additional workup from an abnormality that's being questioned off of a screening mammogram.
Okay.
And so a screening mammogram entails, on average, 2 views per breast. A diagnostic mammogram may include more than those 2 views per breast.
Now, if a woman who's under 30 or even in her early 20s, if she's having some discomfort, she feels something that's not quite right, pain, tenderness, should she see her doctor immediately? And is that possibly the next course of action, is a mammogram?
So if a woman in her 20s and 30s feels a lump, she should absolutely bring that to the attention of her physician. The physician will examine the patient and determine what the next course of action will be. Most commonly, the next course of action would be a breast ultrasound. In a woman of such a young age, we would prefer not to perform a mammogram because a mammogram exposes that patient's breast to radiation. And although it's a very, very small amount of radiation, it's equivalent to getting on a commercial jet and flying coast to coast from California to New York. It's a very small amount. However, in women in their 20s and early 30s, their breasts have not fully developed. So a developing breast is a lot more sensitive to radiation than a mature breast.
I had no idea.
So therefore, in a patient who's in her 20s and 30s, if she feels a lump or her referring physician feels a lump and sends her for imaging, we will absolutely start with a breast ultrasound so that we don't expose her to that radiation.
Wow, that makes sense.
And what procedures are used for breast biopsies?
So breast biopsies may be performed under a multitude of imaging modalities. And what I mean by that is a breast biopsy can be formed under what we call stereotactic guidance. And with that guidance, the guidance is performed with x-rays. It can be performed under ultrasound guidance. And with that guidance, we're seeing our needle and the lesion under ultrasound imaging. And finally, a breast biopsy can be performed under MRI guidance. And in that particular instance, we are targeting the lesion and seeing our needle go through the lesion under an MRI examination.
Interesting.
Technologies has come
Yeah.
so far. There's so many options now.
Yes,
It's
wonderful.
very relieving. I mean,
Yeah.
it's
Well,
wonderful.
I know that, in the past that there was quite a stir because I think some of the guidelines started suggesting that women wait until 50 to start doing regular screening. And there was quite an uproar. Was this a policy statement? Was this coming from the insurance agencies? Was it just cost saving, at the cost of saving people's lives? What do you think about waiting until 50?
I absolutely support starting screening mammography at age 40. The American Cancer Society supports starting screening at age 40, and that is what we at Breastlink believe. There are certainly controversies out there in the public, but scientific data supports beginning screening mammogram at age 40, and that it absolutely finds cancers early on. We want to find cancers in a stage where we can't feel them, where they're very small and they're very early stage and curable. Our goal is to cure women of breast cancer.
If you do find something, a biopsy, is that the next step? What kind of procedures are done to do that next step?
So if one has a screening mammogram and they came in and they're asymptomatic and we see a question, a finding that we want to work up more, we would call them back for either or both additional mammogram views and or an ultrasound, and it may be both of them, and to further evaluate that lesion.
I see.
If after evaluating it, we deem that it's a questionable lesion that needs to be biopsied, that question needs to be answered, what is this? Then we would recommend that the patient go forth with a biopsy. But I do want to stress that approximately 5 to 12% of women who have a screening mammogram will be called back by the facility for additional imaging. And then of those, it's a very, very small minority of those that actually have breast cancer. So if you get a letter in the mail within the 30 days, and in our practice...
Very scary
letter.
Yeah.
Yes. And in our practice, you'd probably get that letter within a few days, and your doctor would probably get that letter within a few hours. So the 30-day period is a maximum that your facility should be giving you those results. But if you get that letter, try not to jump to the worst conclusion.
Hard.
Yeah.
It's really
very
difficult.
scary.
You're staring at it, and
Yeah.
you just want to pick up the phone and call somebody, and you want an answer right now, and it's just, you're shaking.
And we understand that, and it's very, very frightening. We lose sleep over it. We start to imagine the worst. And so we understand that. We at Breastlink get our patients in on that same day if you call and you have a problem.
That's great.
I have to say,
Because
I've never
we-
met a warmer team of doctors.
Yes.
Oh,
That's
thank
fantastic.
you. Thank you.
Well, thank
We
you,
are all
Dr.
passionate about what we do.
I
We
can
love
tell. I
it.
can really tell.
Thank you, Dr. Chen, for answering all of our questions. And of course, we have more. If you want more information, you can go to breastlink.com and visit all of the doctors of Breastlink.
Thank you.
I learned so much.
Stay with us. We'll be right back with more Every Way Woman.